Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, Governor Tom Corbett delivered a $27.1 billion budget to the General Assembly this past week. This is the second year in which the governor proposes to spend less than the year before. Joining me is Lieutenant Governor Jim Cawley to chat about the budget, and then Carolyn Scanlan will be on from the Hospital Association, the first of a series of responses to various aspects of the budget that we will do over the next several months. Pennsylvania Newsmakers, politics in depth and in detail. And guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, before I get to Lieutenant Governor Cawley, we're starting, believe it or not, our 15th year on Pennsylvania Newsmakers on the markets around the state. I want to thank our viewers. I want to thank our viewers, especially on WGAL in South Central Pennsylvania, the Susquehanna Valley, for making us more viewers than This Week, more viewers than Fox News Sunday, more news than the other Sunday talk shows, Chris Matthews, and it's all not because of us. Great guests and your vigilance and your viewership, and we deeply appreciate it. Sitting across from me now is the Lieutenant Governor of the state of Pennsylvania, Jim Cawley. I have to call him Governor Cawley. I'll get email about it. Am I right? You get that all the time.
I do get that. I do get that. A fair amount of people.
You're the Lieutenant Governor. Why are they calling you Governor?
Well, it's very similar to the way in the military when you address a lieutenant colonel. You address him as colonel rather than lieutenant.
Right.
So,
I get it.
Yeah,
but I'll get email about it, so we got that straight. All right. I have a bunch of questions about specifics in the budget.
Oh, I bet you do.
Oh, you bet. No, I do. But before I get into them, give us the overarching view. The overarching rationale for this budget, what is it?
Well, it's very simple, and it goes back to a commitment that candidate Tom Corbett made to the people of Pennsylvania in 2010. He said that if elected, he would bring fiscal responsibility to Harrisburg. He would, in effect, cause state government to do what you and I do as individuals every day, live within our means, that we would end this reckless spending and this runaway taxation that had been the hallmark of Pennsylvania during the previous administration. And he would put Pennsylvania back on the right track to help encourage an environment that will empower the private sector to create family-sustaining jobs. That's what the budget was last year, and that's what this budget proposal is this year. It's an ongoing commitment to fulfill the promises.
And it's more similar, I mean, as I looked at it, we can get into some of the differences, but it's actually more similar to last year's budget than it is different. The amount is like 1/10 of 1% less spending. Do I got that right?
The spend number is almost, it's about $20 million less that we're spending this year.
I think that's 1/10 of 1%.
I'm going to take your word for it, Professor. But I will say this, that it is the first time, certainly in anybody's memory, that the last two budgets have been smaller than the previous year.
Let's get into the pieces of it. I mean, the one thing that I think it comes the hardest for a lot of folks to accept has to do with the higher education cuts. 30% recommendation to the state-relateds, 20% to the state-owned. Lincoln, for some reason among the state-relateds, was not, was kept at the same funding of last year. Maybe you have something to say about this. Here's a question for you. It seems to me that if you want efficiency, maybe you say, well, we'll do a 10% cut or a 5% cut, and that'll make them be more efficient. But it looks like you all just want to get out of funding state-relateds and state-owned schools at all, and let the students take the money in vouchers or whatever. Is that sort of the broad goal of this?
Well, the broad goal of this is to manage the people's money better. And we felt for a long time that the problem wasn't that there was a funding problem in state government. The problem was a spending problem and how it was being spent and what the priorities were. The simple fact of the matter is this, particularly with the state-relateds, and I have to admit, in matters of full disclosure, I'm a double graduate of one of the state-related, and my sister went to Millersville.
And I'm a graduate of a state-owned school.
And my wife went to IUP, so I know of what I speak.
I understand.
And I will tell you that, particularly with the state-relateds, the money that was being spent or being sent spent directly was to be spent in order to keep in-state tuition down. If you look at study after study, one most recently last year from the Commonwealth Foundation, what we found was in the previous 10 years, before last year's budget, spending by Harrisburg on those state relateds either went up or was flat most years, but yet every year tuition went up for in-state, and in fact, in some cases in that 10 years, doubled. So the belief that there's a direct corollary between the amount of money that we're spending and sending to these institutions and the fact that it's going to keep tuition low has not been borne out. And that's why the governor said, you know what, we need to step back and take a look at higher education as a whole in the Commonwealth. And that's why he's impaneled a higher education commission. It's going to be chaired by Rob Wunderling, a former state senator who knows a great deal about higher education. We're going to bring together the best and brightest in Pennsylvania to try to figure out how we do that, how we accomplish the goal of making sure that higher education is affordable and accessible to all Pennsylvanians.
All right, I'm chatting with the Lieutenant Governor. We'll take a quick break and we'll continue this discussion about other aspects of Governor Corbett's budget message. Get that out.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're talking with Lieutenant Governor Jim Cawley. We're looking at Governor Corbett's budget. All right, let's turn to another aspect. I mean, one of the things that I hear is that this budget penalizes the poor. I mean, just be frank about it. I'm not saying this is just what some others have said, that, for example, ending the cash assistance program, 60,000 people who are working poor will be, or who can't work in some cases, will be not denied that revenue. How do you generally respond that you're weakening the safety net in this budget, which, frankly, is a question we get, all the time.
Frankly, nothing could be further from the truth. What we are in fact doing is strengthening the safety net for those who truly need it by making sure that those who can, with a little bit of assistance or a little bit of retraining, can get back into the workforce and no longer have the need for the services that are provided in the Department of Public Welfare. One
of the things I notice you do have is you do have a bunch of new programs to help people who are unemployed gain employment. The FIA grant program, Go ahead.
Well, one in
that.
particular that the governor announced was our Jobs First PA program. It's a four-pronged approach to trying to help the private sector to create family-sustaining jobs. It's got the Pennsylvania Incorporated program, which is basically an enterprise-wide effort of trying to make state government more customer-friendly and being able to help businesses to cut through the red tape so that they can create more jobs. The Keystone program, which is one that kind of goes directly to what it is that you're saying. What we're encouraging now is employers to take people who are on unemployment right now, bring them inside and train them. And while they're being trained, they're eligible to continue to collect unemployment benefits. Right. And once fully trained, can transition off of unemployment and onto the job roles. Right. We've got the targeted industry certificates. This is our work with higher education and with trade schools in order to work with the private sector to make sure that the product that is produced by higher education, by trade schools, that student that is trained has the tools that they need to immediately go to work within the system. We're also beefing up basically our job matching system so that we can look at your very specific skill set and be able to match it with the industry. We're very excited about it, and we think it's going to be part of our ongoing process to put Pennsylvanians back to work.
Despite the tough economy, there's a big debate about what the surplus will be, whether it's $500 million or $700 million. We didn't need to get into that.
The deficit.
I'm sorry, the deficit. Yeah, no surplus. Thanks for correcting me. But you still felt that you could continue the phase out of the capital stock and franchise tax, right?
We felt we had to continue the phase out of the capital stock and franchise tax. One of the things that I think needs to be understood about this budget, this wasn't just Tom Corbett standing in front of a room and wringing his hands and saying, oh, these are tough times and they require tough decisions. It was much more than that. It was the governor setting a course toward a better economic future for Pennsylvania and creating an environment in which job creators, the private sector, are going to be able to come in and establish businesses and grow businesses and put people back to work.
All right, we're chatting with the Lieutenant Governor. We're going to take a break. I want to ask him about some of the block grants and the philosophy behind that when we return.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back. Well, we're continuing our discussion with Lieutenant Governor Jim Cawley. Governor Cawley, I noticed that both in education and in some programs that the counties run, like drug and alcohol programs, for example, you seem to be moving in an entirely new direction for how the state gives those resources back to the schools and to the counties in terms of using block grants instead of mandates. So am I right or wrong about that?
You are absolutely right.
What's the philosophy behind that?
Well, I can tell you this, particularly in this area, I speak with some authority, both as a former school board member and as a former county commissioner. This is something that local government has wanted for a long time, because what you find when you talk to those local government elected officials is that they get frustrated by mandates from Harrisburg that say, you must spend these dollars in these areas.
Right.
What this does is allow for greater efficiencies, because we're sending a chunk of money down to, in the public welfare area, the county commissioners, and in the education area, the school board directors, and saying, you spend it in ways that make sense for your district, so that you may not have to spend as much as has been previously mandated in one area, and you may need to spend more somewhere else.
So you're giving them flexibility among several programs in which to decide how to spend the money, right?
Exactly right. Yeah. And we believe that even though there are reductions in those line items, that those dollars will stretch further, because they're going to be applied to the areas in which they're needed. It's an exciting new concept, and we think it's one that's going to be greatly efficient. And
you think that would be a move forward, that increasingly you will find ways to divest the state of the mandates?
Well, we have said, both Tom Corbett and I said in 2010 that we wanted to come to Harrisburg and make sure that we restored fiscal responsibility. One of the best ways we think we can do that is by rolling back a lot of the unfunded mandates that simply don't make any sense anymore, and make sure that the taxpayers' dollars are being used to their maximum benefit.
Last question. I noticed that there's provision in here to increase a state police class by 115. Then I read something about 113. What's the real number there? 115?
I believe it's 115.
Well, we won't quibble over one or two. The rationale for that?
Well, Tom Corbett and I believe that the first best obligation of government is public safety. And what we found when we arrived here is that the previous administration had not really kept up with cadet classes in order to make sure the people of the Commonwealth remain safe. In some of the more rural areas of this state, they are the only line of defense.
Because there's no,
some
rural townships don't have their own police. Is that the point?
Well, that is part of it, sure. And they are an important, they're an important part of life for all Pennsylvanians, and we wanted to make sure that they were equipped with the men that they need men, of course, being gender neutral, that they need in order to achieve their job.
Just as a segue, there's also, this is the first budget, I think, in 10 years that doesn't have an increase in corrections. Are you comfortable with that?
We are very comfortable with it. Now, a lot of kudos go to Secretary John Wetzel and his team at the Department of Corrections. They were able to do that by finding efficiencies and by making their enterprise much more in line with what the needs are of today by modernization, technology.
Right.
All of that has enabled them to meet their requirements of making sure that that population remains secured and that the public remains safe, but yet not at an additional cost to the taxpayer.
Well, look, thanks for coming on. As this process moves, we'll have appropriation hearings. As you know, there'll be lots of debates, lots of give and take. I noticed the governor said, you know, this is my proposal, and I guess you all understand. We'll see what you can propose and the legislature disposes, I guess is the way to put it. So
Exactly
you'll
right.
come back hopefully in May when we get through the process a little further, and
I'd love it.
we'll check in with it. All right, Carolyn Scanlan from the Hospital Association is here. We're going to get her reaction to the parts of the budget that deal with health care. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back. Well, joining me as often is the case is Carolyn Scanlan. She's the president and CEO of the Hospital and Healthsystem Association. She's one of the experts that we call in from time to time to chat about health care. All right, Carolyn, well, you've had a chance to review the budget. I know there's still a lot of things that we're not sure about and that will be fleshed out, but let's talk about your response to the whole questions about jobs and the economy. Let's start with that aspect of the budget.
Well, that was clearly a theme of the governor's address, and as you know, and we've talked about it before, hospitals in this state are a major job sector, 600,000 jobs, and during the recession, which the governor talked about, so from 2007 to 2011, we added 50,000 jobs where everybody else was subtracting jobs.
Wow.
So that's a pretty significant part, and we want to make sure that there's a recognition of that as we look at the expenditures of the budget.
And the other thing that I think is worth mentioning, many of your hospitals are in, you know, small communities, rural communities where they are the major employer, is that right?
And even in the
Along
urban,
with usually an education institution, right?
along with even in the urban. So in the
that's
fif-
right.
in
Pittsburgh,
55 out of the counties in the state, we're in the top 5 employers.
So in 55 of 67 counties, you're in the top
5.
5 employers.
That's significant.
Okay, it certainly is. Well, I know this is quick and it's, you know, we'll have you back and we can get into the details of it. It gets along, but what immediate impact do you see in this budget on hospitals in the state?
Well, there's 2 pieces. One is sort of a direct proposal to cut payments to hospitals by about 4%. And, you know, that any cut to hospitals is a problem because we're already underpaid for taking care of medical assistance patients.
And that is because Medicaid payments are far lower than the actual cost. Am I right or wrong about that?
83% lower than the actual
83%.
3% less than the cost.
So that means your hospitals have to make up
The difference.
by?
Well, you know, for a 3-year period, that cumulative difference is $1.4 billion.
Wow.
So we do it by charging private pay patients more through insurance contracts, or just absorbing that government cost that we are carrying. So those direct costs are pretty significant. There's also, as you had the conversation with Governor Cawley, there are some significant changes in taking care of certain populations in the Department of Public Welfare budget. And some of that will impact the kind of care that those patients or individuals will be entitled to under those various programs.
You think the care, as maybe you haven't had a chance to review it yet, you think the care will be reduced?
I
for
think there will be.
And you'll get less money or both?
We won't get paid. If a person is no longer eligible to be in a certain category, that means that they're not eligible to get health care. That means that they won't come to get the care and we won't get paid. Or if they come,
You'll have to do it, and
We'll
you
have
won't
to
get
do
paid
it, and it'll
anyway.
be uncompensated
Yeah, you don't turn
care.
people away, right?
We don't
They come
turn
in
people
and-
away.
yeah.
So last year, we provided $1 billion worth of uncompensated care.
Mm-hmm.
This will just increase that. And that's problematic for hospitals.
Mm-hmm.
But we really need to analyze this budget a lot further
Right.
to understand what that impact
Mm-hmm.
is.
One of the other considerations, I think, is the impact that these programs had on people. You know, I asked the Lieutenant Governor about the impact on the poor with the cash assistance program, and that there are some criticisms of this budget that others have made, some Democrats and some independent analysts, for that side of it. And we heard, you know, what he had to say, and I think there'll be a vigorous debate over that subject in the next couple of months. So what is your sense about the impact on people as it relates to health care?
Well, again, it's hard because we need to do this further analysis. And so if you're cutting funding for mental health services or behavioral health services or drug and alcohol services, that's health care. And even though the counties get to designate how they want to spend it, and the governor and the lieutenant governor believe that there'll be savings, we worry about how those cuts in those basic funds that they're now creating translate into care. So we really are concerned that we all need to make sure that there's no patient that's harmed
Right.
or is denied access to care when they need it.
Yeah, that's a good
And we
point.
want to make sure of that.
Now, is there a relationship between the federal government's budget and the state government's budget, and how they're on parallel tracks that worries you?
Well, yes. I mean, clearly the federal government does the appropriations for Medicare,
Right.
and that's the program for people 65 and over. So if Medicare payments to hospitals or services get reduced, that again is less money to
Less money.
hospitals. So we worry about that. We worry about the physicians getting paid their full fee schedule, and that's a big debate right now in Washington.
That's correct.
And the federal government sets the parameters for the medical assistance program. So if they change the parameters, or the federal government limits the amount of money that it gives the state, that causes the state to change what it will do, and that's of concern, obviously.
So we have about 45 seconds left. So your concern is that there's tremendous flux, both at the federal government and the state government, leading to a lot of uncertainty in the healthcare community as a whole. Is that
I think that's a very fair statement, and if you think about that these are businesses, I mean, we like to think about them delivering care, but they're also business enterprises, and no business enterprise can do any kind of business plan if you don't know the kind of revenue you're going to be getting.
All right, well, look, thanks for the great update. When you get a chance, as we get through, and there'll probably be amendments to the governor's proposal, we'll have you in. You can help us out, and we'll see you next week for another edition of Pennsylvania Newsmakers. Stay well.